Hi friends, welcome to our channel. It's a routine case with grade 2 cataract, and in this case I will show you why we shifted from direct chop to stop and chop. So a male 62 years old, grade 2 cataract, visco was poured over the cornea to make the cornea clarity more. Now it's time to make the entry. I normally make a 3 planar incision at posterior limbal site. I use a tooth forceps to hold the eye. You should always have one instrument whenever you have any sharp instrument into the other hand to hold the eye. The entry is done. Now it's time to prepare for the capsulorhexis. So my first step is to put an air bubble. Now it's time to put blurring. We should take care that it should go all over the anterior capsule so that it stains the capsule 360 degree. Now it's time to put visco. As you can see, there is some bleeding from the section. In posterior limbal incision, the healing is fast. Now we are doing capsulorhexis with 26 gauge cannula. Our aim is to make a axis of at least 4.5 to 5 mm. In harder cataract, you can make up to 5.5 mm also. The axis is completed. A side port entry is made 4 o'clock hours away from the main incision. You can make it at 3 o'clock or 4 o'clock hours as per your convenience. Now it's time to do hydro. Before hydro, I always decompress the anterior chamber and remove some visco also. The multi-quadrant hydro is done. With that, the nuclear decompression was also done. Now the visco injection is done. It's time to start the phaco. As we have planned direct chop, we are in phaco 2. I always enter the eye with the irrigation on. If you enter without irrigation on, you will have a big air bubble inside. So it's safe to start with the irrigation on. The epinuclear removal is done above the nucleus. Now as I started the direct chop, you can see as the vacuum is 380, power is 60. As I'm trying to hold the nucleus, maybe it's little soft as per the grading 2 of nucleus. So I'm not able to take a hold. Here I had two options. Either I can decrease the vacuum or I can shift to stop and chop and enter into phaco 1. So I planned to shift in phaco 1 and did stop and chop, as you can see. So during surgery you should take care that it's not a compulsion that if you have planned a direct chop and you are not comfortable to continue with that, you can always shift to stop and chop, divide and conquer as per the convenience and as per the case. Because our main aim is to get a clear cornea next day and to put the lens properly. You can see stop and chop, we got a full crack. Now we have two deep segments of the nucleus. It's time to shift to phaco 2. The nuclear piece are rotated slightly. By vertical chop, the D segment is divided into two and emulsified and aspirated. As you can see, we always aspirate the nuclear piece into the center of the cornea because here we have maximum space. Last piece you have to take care that you have to be slow because here maximum PC rent happens. Now we are putting some visco It's time to do coaxial IA. You can use bimanual IA also as per your convenience. I am more comfortable with the coaxial IA. The vacuum is 450 here. As you can see, to aspirate the cortex, we always start from the periphery. We pull the cortex, bring it to center, and then apply the full vacuum. Here you can see one thing in video, that as we are pulling the cortex, sometimes if some epinuclear piece comes and block your coaxial IA, then you can use a second instrument like this. Like I'm using my dialer. Either the cortex is thick or the epinuclear fragment has blocked the cannula tip of the coaxial. So you can, with the help of a dialer, you can aspirate the epinuclear piece or thick cortex chunk. So it will save your time and makes the procedure easy. Now we are at the end of the cortical wash. The cortical wash is completed now. Now I am doing some polishing. There are some fibers, so you can do polishing with your coaxial irrigation on. Now it's time to put some visco and form the chamber. In this case, we have planned to inject Hoya 250 lens. It's a preloaded lens, a spheric lens, and the delivery system is very nice. There are no financial interest here. The lens is placed into the position into the bag. Both the haptics are in the bag. Now we have to do the visco wash both in front and behind the IOL. At this stage, you should give some time. When you are washing in front of IOL, always wash at all the angles also, so that the pressure doesn't increase. Now I am going behind the IOL, lifting the edge of the IOL and putting my coaxial there with irrigation on. With experience, you can also start aspiring. A good visco wash will give you a clear cornea next day and the pressures will be normal next day. Now it's time to hydrate the incision. After a little AC wash, we hydrate both the sides of the incision. First, the main one, followed by the hydration from the side port. So it gives us a formed chamber with IOL in place. Thanks for watching.